2:29, but I failed to, I'm going to take a minute longer and still talk about Bacillus anthracis because I forgot to show you just a couple of things. Okay, so I was talking about Bacillus anthracis, and I wanted to show you a couple more slides. On occasion, everybody has a type of organism, which is probably Bacillus, that looks really mucoidy. And I bet you've seen this before. It's usually a great contaminant, and it's just the ugliest thing in the world. It looks so slimy. But don't be concerned. This type of organism that spreads through a whole plate, well, Bacillus anthracis will spread through the whole plate too, but for it to look that mucoidy, you can rule it out. Your organism should stay very nicely ground glass looking. Same way with the gram stain. You know, it's so easy to say, oh, gram positive rod, and not know what size you're dealing with. I've had a lot of people struggle with that, especially if they were generalists and didn't know, have much experience with gram stains. Because this is on the left side is a gram positive rod too. So if you have a reference, if you're asking anybody to do gram stains, do have a reference box of slides out that have knowns in it, like a known diphtheroid or a lactobacillus or something that they can compare the size to versus a bacillus. And I think that is very important to especially the people who don't have much experience. There are a lot of mimics, though, that are out there that eventually will be ruled out. For instance, this one to the right, this is a Bacillus stern strain, which is not, what do you call it? It is not, Tony, what's the word I'm looking for? It won't cause a disease, although I know that the Russians, if you ever read about bio threats back in the 50s, the Russians used to use this to experiment with. But here's but this organism right here on the left very much looks suspicious. And so, yeah, if you don't have the confidence, if you are not confident about ruling it out, don't hesitate to call your public health laboratory. Also, there's gram stain mimics that could be out there. I mean, you could have organisms that look like this. Anaerobes, Clostridium can look like this. Here's your stern strain. So just because this doesn't have spores, don't rule it out. I mean, go through that, the LRN flow chart and make sure that you can rule this one out. The example I gave came from a case study back in 2000 in Minnesota, farmer that had worked with an organ, or had worked with cattle and actually did get the organism. All right, when you have a positive or even are suspicious, I guess the first thing I would do is talk to my laboratory supervisor. Don't call this yourself unless it's the weekend and you're only one there. Talk to your other fellow laboratorians. Make sure that you feel comfortable with it, ruling it in or out. If you can't rule it out, you know, what should you do with it next? Definitely call your attending physician or infectious control. Talk to them, tell them that you're going to be sending it to NPHL or your public health laboratory. At some point, if it is confirmed positive, we are going to let your county health department know, because then if multiple cases come up, then they will have some idea. And obviously that even goes to the state epidemiologists as well. All right, so we're going to go ahead and get into the sticky parts of the more difficult organisms. Not that anthrax is easy, but people usually feel comfortable with that one. We're going to get into brucella, the Burkholderias, Francisella tularensis, and also Yersinia pestis. So here's the case study, and I'm just going to walk you through it, and I'm going to ask questions, but I want you just to verbally click off. If you're on mute, click off and go ahead and somebody give me an answer. All right. So my first question here is a culture which you're going to be reading out, and you have been a fabulous technologist to look at your requisition first. So what in this requisition do you notice might be a trigger point?
Well, lymphadenopathy.
I have to apologize. I have a hard time here. Oops. Hold on. Go ahead. Say that again. Or put it into chat, because whoever said something, I couldn't hear them. Thank you. So Marnelli says it's a hamster bite, tiny gray white colonies. Yes, that's definitely one trigger point. What else might be a trigger point?
Nothing on the gram stain.
What?
There was nothing on the gram stain.
Right. Thank you. So number 2, nothing on the gram stain, but yet you have growth. Good one. What else?
The fact that it took a day, more than a day, for it to grow.
Right. In fact, what's it look like? From the 19th to the
21st.
You subbed it on the 20th, and then yeah, so 3 days or so, 4 days. So it took a long time, whereas most organisms will turn what in 24 hours. Good one. That's another one. There's actually more in there. Where was that patient located at when they took the specimen?
Peds ICU, right?
Peds ICU. So you know they're really sick if they're in the hospital. This isn't just a clinic case or anything like that. And then, of course, here it says left ancillary lymph node. Not too many organisms get into the lymph node either. And they even noted that there was treatment failure. So you know this has got to be a really ugly organism. I wouldn't rule it in or out by just the treatment failure, but I think the combination of all of these things that we just talked about is very important. All right, so if we go on, so this is the gram stain. You do, you know, organisms seen on the original. So how else are you going to know to go onward until you repeat the gram stain? So you hopefully do this in the biosafety cabinet, and because that's a trigger point in itself. No organism seen and you have growth. Definitely take it into the biosafety cabinet first before you manipulate it. And you see something like this, and you describe it as this gram-negative something, but you don't know. It's so tiny and so unclear if it's a rod or a cocci even, right? You can't tell us. In fact, it could be a blood culture bottle that has all the red cells still in it. But you know this is actually from a plate, so you know it should be pure. So if you are seeing something that you can't really describe, what do? Well, I would say go to the slide that it kind of walks you through gram-negative, the summary page, walks you through the gram-negative coccobacilli or small gram-negative rods. If it's tiny, pleomorphic, poorly staining, mostly single cells, you might want to look for this type of growth. If it is faintly staining, but gram-negative coccobacilli. Actually, it appears as a gram-positive cocci. You can see the cocci shapes. It might be, and if it fits these growing tendencies, then it might be a brucella. Or if it is just, it's, either a very small rod or coccobacilli, but you can see, nice shapes, and it looks like it's bundling and has rounded edges or something like this, and it's growing like this, well, then you might have a Burkholderia. So you at least know where to start. And what I would do is I would go through each one of these LRN protocol and start ruling out. In fact, what I always recommend is you start with the oxidase, because that tends to rule out 2 out of 3 anyway. So one thing that I think a lot of people have problems with is determining, is it gram-negative coccobacilli versus gram-negative bacilli. Yeah, it looks easy on picture, but when you get in real life, it is not that easy. So here's another trick to the trade. I have not added to my bench guide yet, but it's in the APHL bench guide. And I love this thing because it's talks about the way, another way to rule them out differently, to differentiate these, is to see if there's growth on McConkeys. Because if there is growth on McConkeys, it could be a pseudomallii or a Yersinia pestis. If it's no growth or extremely small growth, it could be the small gram-negative diplococci. So do you see where this, rather than trying to determine from the gram stain what it is, look at your McConkey plate. That will help you determine what chart to go to. Do you go to the gram-negative chart, or do you go to the, gram-negative rods chart, or the gram-negative coccobacilli chart? So according to LRN protocol, what testing is recommended? Well, I always say start with the, what's my problem here? Start with the oxidase. And if I were to tell you the oxidase is negative, think about it. Look through those, if you have your chart with you, what your MPHL, because I mentioned something about printing out your LRN bench guide. So look to see what of those 3 organisms we just mentioned. We know that they're probably gram-negative coccobacilli because there's no growth on McConkey. And have I told you that yet? Well, assume there is no growth on McConkeys at this point. So I tell you that, and I want you to do an oxidase. Oxidase is negative. So then what organisms have we been able to rule out so far of those 3 organisms in that summary page?
Burkholderia.
Well, and
It's oxidase negative. Brucella.
so somebody did mention Francisella, but Francisella
Brucella.
is oxidase negative, so we haven't ruled Francisella out. What we can rule out is, did anybody else say it?
Brucella.
What's that?
Brucella.
Yes, thank you. Brucella. So here we've ruled out Brucella for sure, and maybe even possibly Burkholderia mallii. Now, in your chart, mallii, if you turn to that page, and I have it somewhere here. Oh, that's okay, Arnell. If you have, well, what I was going to say is that it's just I lost my train of thought here. Sorry, but yeah, even the Burkholderia mallei is iffy and usually is negative. So, and it's an organism we don't see here in the United States. So just being in the United States, I take that into account that probably is not that organism either. So I know it's oxidase negative. And then if you go to the one that we know is oxidase negative, which is our Francisella. And I'm sorry for those of you that don't have a camera, but I'm so glad you could hear everybody. Okay, so let's say our catalase is positive. Now, seeing a weak positive versus a strong positive is virtually impossible in the tube. That might have been something that the books say for a slide catalase, but we are not recommending slide catalases here. So just any positive in your catalase and a negative for oxidase really points to what organism?
Tularemia.
Yes, Francisella tularemia, exactly. Now, can we rule out mallei yet? The Burkholderia malleis? Not yet, but once again, except for the fact it's not seen in the United States, but weird things happen in this world today. So here is the Francisella chart. Again, what we're saying that it's a very tiny organism. In fact, it's so tiny that it's hard to, tell the difference between cells. You can't even tell if it's cells or junk. That's a sign in itself that you have a possible tularemia. The other thing to remember as this organism may or may not grow on chocolate. In fact, if you're taking it from a blood culture and you put it to blood plate and chocolate plate, it's quite possible that you're also subbing all the nutrients from the blood culture media and putting it on both plates. And it will allow, even though Francisella should not grow on chocolate or blood, it should only grow on chocolate, but sometimes you're deceived. It can grow slightly because of the blood, the media, the enriched media of the blood culture. And then you'll see tiny growth, but it's not going to be as big. That's why we made that comment that another trigger point is if you see a lot of growth on chocolate, but very tiny growth on blood, it's just that particular scenario. Now, if you were to subsequently try to sub that little growth you see on blood, the first blood plate, and put it to a second blood plate, you passage it again, it's not going to grow. And that's because now you don't have enough of that nutrient media to allow it to grow on the blood plate. Well, why does this happen? Does anybody have any idea? Why does it grow on chocolate, but not on blood?
Doesn't it need like hemin or?
Yes.
Yeah.
Yes. Actually, it needs both. So you think about Haemophilus. This is an organism that we could easily misidentify. We could just think it's a Haemophilus influenza and just start going down that line. If you don't do the rule outs first, you could find that, and the reason I say this is because if you don't do the oxidase, Haemophilus influenza is usually oxidase positive. And so you haven't ruled out the Francisella yet. And that's a lot of people get Francisella mixed up with Haemophilus. And there's been many people who've worked on Haemophilus for 2 or 3 days until at one point, oh, now it's not growing on blood. And oh, we do have a Francisella. And that's where the exposures happen. All right. So yeah, the reason is because it needs two nutrients, and that is that blood plates do not have. It needs the NAD and the hemin. Now, blood plates do not have that. The reason chocolate plates have it is because how is chocolate made? It's just a blood plate that before they pour it, they actually lyse the red blood cells, which allows the hemin and DNA to escape into the media, and it is available to grow. So these more fastidious organisms do grow well on chocolate, but should not grow on blood plate. But sometimes because of other circumstances, you might see a little growth too. And I just don't think Haemophilus influenza does that. Okay, so all right, you've done your oxidase, you've done your catalase. Now, the other one that really will help you out is beta-lactamase. I know some labs don't have beta-lactamase, especially if you're a small laboratory. In Nebraska, you would have to just call me or email me. I will send you beta-lactamase and the QC organisms to go with it. And then you could use this to work on or rule out. All right. And if your beta-lactamase is highly positive, you can feel assured that more than likely it is probably going to be the Francisella. Now, I know that our chart here, and I think the APHL chart also says you should probably do a urease just to rule out for Brucella. And then also to do the satelliting or to do the XMB plate. The satelliting is just a really old test to look for. I wonder if I have it. Yeah, here to look for Haemophilus influenza. And it's just not a test done anymore because most people will do the XMB plate. If you absolutely have to, you could even do the rapid what is the Rapid Anna or the Remel product called, not Rapid Anna, Rapid NH. And that's a 4-hour test that also will detect if it's Haemophilus or if it's something else. And you would see right here where you have satelliting because you're in the staph. So how the satelliting works is you take your plate, and several plates, and you sub your unknown organism. And then you sub it this way, like up and down, and then just take one streak of a staph aureus and go across. So all staffs will submit the known or the required factors. And so that's why you get growth with that satellite's close to the staph, because the staph diffuses these nutrients out a little ways, but not the whole plate. Whereas this is a negative, obviously, and so that is not going to, or excuse me, is it the other way around? This is going to be your Haemophilus if it's satelliting, and this is not Haemophilus. So the one important thing I'm trying to say is Haemophilus is easily confused. Make sure that you do the proper test to rule it out, Haemophilus out. You can do that by the this methodology here, just by doing just these tests. And maybe even possibly if you feel like you want to go on, rule it out the urease. And then I would not recommend the satellite plate. That's just a little bit too tough. If you have the Remel product or if you have the XMB panel. But if you don't even have that, I would just stop at the urease and call your local health department. So let me go real quickly through what Francisella is. It is an organism that causes tularemia, but a lot of people around here who are not medically minded just call it rabbit fever. So you have hunters, you have farmers that come down with tularemia. They know it as rabbit fever. All right, so it's usually gotten because you're exposed with tissue from an infected animal. You unfortunately mow lawns for a living and you've mowed over a rabbit. We have had people that they said they felt something squirt into their face. Yuck. But that was what happened. They mowed over an infected rabbit and got infected. Even the arthropods, the ticks and the fleas might infect your domestic animals, your domestic dog, your domestic cat. I love the story of here a couple years ago in Nebraska. We literally had a 98-year-old lady in a nursing home who had never gone outside. So she wasn't a hunter. She couldn't have gotten it from her dog or whatever. And they couldn't figure out how this lady got Francisella in the nursing home. Come to find out that the therapy dog who came and visited her every day had Francisella. So unfortunately, she came down with it. She managed through it fine, but it was not fun, I'm sure. Even contaminated food and water can cause problems. So this is something that it very much in the rural life can be seen, and certain occupational hazards like veterinary again, it is quite known in cats and dogs as well. So now it's again not contagious person to person. The treatment, is rather good if it's low, and even mortality. Well, mortality can be moderate if it's untreated. So it can be a nasty disease, but nasty wound won't heal unless you have the right antibiotic. And the point is it's easy to treat. It's a simple antibiotic. I don't remember if it's an erythromycin or something. So the sooner somebody can identify this and recognize the trigger points, the better, so that this patient can be on the right antibiotic. It may be that the doctor put him on a broad spectrum, but this broad spectrum might not be good enough to be able to hit Francisella. All right, other forms of tularemia. We have seen it in the eye, ulcer glandular or granular, oculogranular is the eye, sorry. Even nasopharyngeal, it can be pneumonic if the organism is inhaled, very rare, but it's happened. And then also even symptomatically, it can get into the, without lesions, can get into the lymph nodes and present itself there. So don't be, ruling it out because it's not just an ugly wound. It can be almost anywhere. We do see it throughout the United States. As we know, in Nebraska, it's very common. We have it a couple times a year. I've seen it as much as a dozen times. But as you look in Missouri, to all of us that have relatives down there, it is quite common. And it's usually that infected arthropod, the tick, and the deer fly. That is on your animals that bring it in, especially the domestic animals. And the laboratorian, the farmer, and the veterinarian are the people who are at risk with this organism. All right, so I took the case from here. All right, going on, because I know my time is running out and I only have 2 minutes. Oh my God. So what I'm going to do is have you quickly try this. And I want all of you to put the answers in my name. And I'll only give you a couple seconds. 30 seconds or so to answer, but we'll try it. And I want you to go ahead and use, do like we've done with these cases before. My first questions to you is look at the requisition. Tell me what the trigger points are. There are going to be some weird ones, but go ahead and type a private message to me and let me know what you think are all the trigger points. Don't mention just one, mention everything that you see.
Okay. So,
If you can, if you have access to, yeah, okay, great. All right, any other answers? Okay, good, good, good. Okay. Yep. Great. See a couple more coming. Tyler likes the good one that you'll probably never see in your lifetime, but it was a true story. So this whole thing is a true story. So some of the symptoms in the history are quite real. Okay.
They said the blood chocolate max.
Yeah. Anybody else?
Everything is positive.
All right. So what you probably should have answered to that was the fact that this was a patient who came in, 30-year-old female in ICU, pretty darn sick, and she has fever, malaise, and respiratory failure. Yeah. So history, the possible exposure to lab flask and culture kept in apartment with boyfriend is a loud scream to first responders. That is just a no-no in the real world. And so they should be very concerned with that one. I'm sure that, these things were probably taken in for evidence when this person reported this. Okay, so we had an aerobic culture collected on the 19th, received in lab on the 19th. It was, where's the gram stain? Well, I haven't shown the gram stain. Oh yeah, no, here it is. No organism seen. So that's another trigger point. Anything that has growth, but nothing seen in an original gram stain. You really need to dig out the old gram stain and review it. And if you can't see anything there, even try to repeat it. And it's possible. I've had Franciscellas where you can't see anything. You do blood culture and those organisms hide so well in the midst of all the red cell debris of a blood culture. So the real problem comes is if this is truly a blood culture, and that is, I believe, one of the sources, aerobic blood, you're probably returned it to the back tech. So by the time you're reading it out, this is at 24 hours. Yeah, and at 24 hours, you see no growth, which would be day 4 or day 5 of blood culture. And how long do we keep blood cultures? We only keep them 5 days. So in other words, it's possible that you have accidentally now thrown this blood culture away. And it doesn't show growth until day 6. And when you go to gram stain this, so what I'm saying about throwing away, do not throw any blood or any blood culture or lymph node or whatever that has been put into blood culture. Don't throw it away, your positives away until you're done with even identifying and finalizing the patient. Always keep your bottles positive. Don't just throw them away at day 5. Keep the ones that are positive, and then you may have to refer to it back. back to that. But yeah, here's your gram stain. And so now that's my next question to you that I want you to all type in. How would you read out this gram stain? You tell me how you would report this to the doctor. I mean, what message would you put in your LIS system to report this gram stain to the doctor?
I mean, they're not staining this.
Yeah, this is a tough one because you're really not sure if it's gram negative, gram positive. Is it coccobacilli? Is it diplococci? Is it a small gram negative rod? So really, it just shows that your answers are kind of across the board, and that's just what it's going to be. However, think back to our last gram stain. That one was so tiny, we could hardly tell if it was sand, specks of sand or debris or whatever. Here, we actually see organisms. We see individual cells. Some of them might look cocci-like, some of them look rod-like. So I think you are right to say coccobacilli and report it out as gram variable. So why is it gram variable? I'll talk about that in a moment. So let's talk about what you're doing with the plates. So I don't know if I've said this yet, but let's look at the plates. Hopefully, because there's no growth or nothing in the gram stain, and you have growth on the plates, go ahead and take it into the biosafety cabinet. And let's say you had growth on blood and chocolate, but not McConkey. So now I want you to think back to what no growth on McConkey means. And that might not be in that chart of the bench book that I had you print, but I kind of talked about anything that's not growing on McConkey is probably not a gram negative rod. See if that helps. So now, all right. So if you have growth on chocolate and blood, what part of the summary pages are you going for? And tell me what organisms fit in that family. So what two organisms would fit in this family? And if you think about it, it's probably going to be the same group that we were on before, right? Yeah. Yeah, so it would have to be either the Francisella, the Brucella, or the Burkholderia mallei. And really thinking we're in the United States, maybe we could bring it down to just Brucella and Francisella. So what tests can you do? And I have always said oxidase, start always with oxidase. So if I were to tell you as oxidase positive, now, what is your suspicion of those three organisms? That might be enough to either rule it in or out. So I'm going to give you like 30 seconds or so. I want everybody to type in what organism from those three that we just mentioned, which one do you think it is? Yeah, exactly. Right, cannot rule out Brucella. Very good. So I just gave that answer away, but that's all right. You guys have all got, oops. All right, and then so I would have you follow up. However, just because oxidase is positive, I'd still have you follow up with catalase and then with that urease. Let's talk about urease a little. If you're doing tube urease, it is something that's going to be, it depends upon the species, because the urease is going to be rapidly positive for things like Brucella canis and some of the other species, but not for, but it may take up to 24 hours for some of the other species. So it's great if it's rapid. And when I say rapid, I mean within 15 minutes. How do you get it to turn within such a short time? There's some tricks to the trade. One, take your urease tube and let it warm up, stick it under your armpit, or, you know, put it in your hands and rub it to warm up your urease. Because if it's cold, the organism doesn't start developing or developing the urease. Yeah. So, and then inoculate it once it's warm. And that's the way, and then incubate it in your 35-degree incubator and give it at least a good 15 minutes to 30 minutes. Look at it right away, because if you have a really rapid positive, you can feel very confident it's a Brucella. But don't throw it away or rule it out if you know it's if it's urease negative. You're going to have to re-incubate it until overnight and look at it the next day, and that will tell you you probably still have a Brucella, but it might be one of the other species. All right, and this is what our chart shows here to do. To first do the oxidase, then the catalase, and then that urease. If it's rapid, great, or if it takes a full 24 hours, still, it does not rule out Brucella and to contact us. Now, if you've accidentally been working on this organism and you didn't think anything about it, and you accidentally put it on the system, it happens all the time. Be aware, your Maldives or other systems probably do not have Brucella in its library. So in other words, it is going to be identified as Otobacterium, Psychobacter, an Oligella urolytica, which is a fast urease positive organism. It can even be identified as a Bordetella bronchoseptica. And those are common organisms in the lab. But if this is a slow grower, don't trust those IDs from the Maldives. You would want to probably still have your public health laboratory rule it out by other means. All right. So with our time rolling short, I will just take a few minutes, go through the Brucellas, and then I'm going to send out the last case. I'm going to just kind of have you read through it. It'll give you the answers, but practice it as you go. And that'll give you some experience with it. The last one, no, I won't give you the answer to the last one. But anyway, so, okay. Brucella is a organism that causes brucellosis. Again, it's a zoonotic thing. You know, your rural animals will have it. It can be in unpasteurized milk. And of course, unpasteurized milk is not too common, but you do see it in the United States. In fact, for a while, it's become very popular. It can be inhalated. In fact, brucellosis is probably one of the more dangerous organisms to you as a laboratorian. It is, what shall I say, probably 25 times more dangerous to you as a laboratorian than even to the farm workers that experience it out in the field. It causes flu-like symptoms, anorexia, arthritis. You just feel like you have COVID. Well, no, not quite that bad, but it feels like you have influenza, And I've known people who tell me they thought they had influenza for several days, but their tests were always negative. But you are struck that much with it. And the unfortunate thing is, if you don't catch it right away, the person who has brucella, did I say that right? Yeah, the person who has brucella might have it forever. They might never really clear the symptoms. It seems like the symptoms come back to haunt you. The mortality rate is really small, but you can always have the fever and fatigue hit you. It might be a couple months, it might be a couple years, but they do come back to haunt you. All right. So here are the different animals they each infect. So it's really good to know the history of the patient. Now, we talked a little bit about bone marrow. A lot of times physicians will ask that bone marrow is put into blood culture. And I think I described why. Well, years ago, it used to be that the physicians would ask you to hold it for 21 days because the media wasn't as nutritious as it is nowadays in the blood bottle. Now it doesn't take 21 days. It used to, though, so you might have a physician ask you to take it that, or to hold it that long. But in reality, if you really had Francisella or brucella, it would grow a lot better, probably even at 5 days. And that's why I mentioned extended incubation time. So if you do accidentally get it on the system, we talked a little bit about what it can be misidentified as. And here's one article that talks about that is where I took the case study from. It was a laboratorian who had her boyfriend talked her into bringing home some brucella, and he was growing it, God knows why. But she came down sick with it. But thank God he hadn't done whatever devious thing he was supposed to be doing. But I think he was in jail after that. So, all right. Well, I know, is that the wildest story you have ever heard? But I think you all have heard wild stories, and it's always very interesting to read about these things. I think what is really disturbing too is that we've had more and more of these organisms being identified by the MALDI or misidentified by the MALDI. I'm seeing more stories about that. So anyway, to let you go, I appreciate you guys being with me today. Give me a second. You are going to go through the fourth one. And then I think there was just a little bit I wanted to share. I want you to read about the two Burkhold areas. I'm not going to go through them. You might be tested on them, however. So do read this directly, because we have heard about some Burkholderia in pseudomallii in Kansas. And there were 3 states, Texas, Minnesota, Kansas, or Missouri, I don't remember, but that's scary because those are all surrounding states, and it might not be long before we see it in our state. So keep in mind the pseudomallii belongs to a different group where Yersinia and pseudomallii, these are gram-negative rods. So they're going to be honking big gram-negative rods that might, and look at the characteristics there that you can identify from even the morphology or possibly the clinical presentation. Read through those. I've got some gram stains. I've got some McConkey plates to show you. So it'll walk you through the answers of all of those. The last thing I wanted to share is that, in the new age of microbiology, it is something that we're getting very used to, people doing sequencing and biofire. So they begin to realize that it's so easy to identify it from that. But do remember, most of these organisms are not in that library. So they don't react much anyway. So it could be called another organism. So correlate it. Make sure that what you think it is, or what the MALDI calls it, if you accidentally put it on there, that it grows on the right place, that morphology looks like what it should be, what it was called as, and do in any situation, do that rule out and refer just to be safe. I also talked about Neisseria meningitis. I just want you to read through that on how to identify it. I talked about TB because we're beginning to get worried about TB because, well, it's an organism that not many labs do, but they're trying to do it in their BSL-2 laboratory. So it could be problematic, and I worry about laboratorians coming down with it. Other unusual organisms, there are a lot of unusual organisms your physician may call you about. Coxiella, they might call you, heavens forbid, about smallpox, or the Staphylococcus, enterotoxin B. All that information is right by a click away, that you can click on these and you'll be able to read more about them and whether you need to, what you need to submit to your public health lab. But in reality, if you just want to call your public health laboratory, that's the easiest way, so you get their assistance. We have provided in our website for these real unusual ones. I know I've got anthrax, brucella, and the plague here. If you have a physician that calls and says, oh God, I think I had brucella, what should I collect? What kind of specimens? Or if I think I have plague, what should I do there? Then your setups, this is a chart your setups group can use, but it also has smallpox, that staph enterotoxin one. So if you get the really weird calls about Coxiella, this chart will help you know what to tell the physician. New and emerging, I think it's obvious that now with ecosystem and global warming, we are having the weirdest things. And that's what happens, we get a pandemic because our our whole environmental system is changing. We always worry about biocrime, bioterrorism, and it's still there. It still may happen someday. So you guys are our front lines. The laboratorians are our front lines. We are depending upon you to help us to pick out these organisms and do the LRN on it. But yet we want to make it as easy as possible. We only want you to do certain biochemicals. We don't want you to go through the back charts and do every biochemical on that chart, because that'll be more confusing. Follow the protocol, follow that chart, that flow chart, to help you identify it. A little more about influenza pandemic, which is kind of old news at this point. One other thing I wanted to point out, knowing that we're doing a lot of RIDTs, which is rapid influenza, but it's also rapid COVID anymore. You have to remember some of these tests are open, what I would call open bench type design. They're not closed type tests unless you're doing it under the biosafety cabinet. So many CNAs in doctors' offices do these things, and these things are aerosolized, and it's shown by this slide here that they had put in a black or something fluorescing, and under a black light you can see how bad pipetting, even though you know how to pipette perfectly, it still can aerosolize. So we will talk about shipping at a later time. Just know that there's some important parts. And also for you Nebraskans, we have a special kit just for Ebola, not for the really hazardous organisms. Ebola some of them, but not the Brucella francisella. That can go by a regular category A box that we show here. All right. I think that's it. If you have any questions, there's lots of additional resources. I would be, if you guys have to go, feel free, because I know I'm over time now by quite a bit here. So it tells me next time I can't say 1 to 3. I'll have to say probably 3.5 hours or 2.5 hours. But I'll entertain any questions. I'll stay online if you would like. But thank you. I will send out the whole presentation. I'll have you finish the last one yourself and any other information. Then I will give you the exam to follow up and the challenge set likewise. So we'll still be talking to you. I greatly appreciate you being here today and staying with us over time. So thank you. Thank you very much. And I will entertain any questions right now.
Thank you.
You bet. Thank you.
So the NU alert for submission form submittal, that appears to be something that only one person can be connected to at a time.
Which one are you talking about again, Marissa?
The NU alert.
Okay. So NU alert, I didn't describe it in here since we have multiple states with, but NU alert is kind of like our LIS. And so we do make it available to you. In fact, if you look at my website, like the blah, blah, blah. Which one is, very first one. It says alert, but it should be NU alert. You can enter your organ, if you have a suspicious organism, or if you're sending any other testing to NPHL, you can enter it through that. Most people with suspicious organisms that they are unable to rule out, they just call the lab. Now, there's another system out there called StatPack, which has been down for about a year. Some of your laboratories have it, some of you don't. And we hope that we can get this up by Christmas time. We hope that the laboratories that don't have it would consider bringing it up again. And actually, that's an easier way than New Alert. And it's the best way. It will page us automatically within, within a minute. And then we could talk to you within 5 minutes as soon as we can get to a phone.
Okay,
so
kind of
yeah.
My next question was, they want us to notify them through the pager system. Is that all we have to do, or then do we have to call client services?
No, in fact, I recommend not calling client services unless you're just concerned about a courier. You don't know what courier to use, but in reality, I would have you call us. Our regular number is the 402-559-9444, but somebody is not always there. So use the pay or our 24/7 number, and somebody will always be on that pager, and they should answer you immediately. Especially in nights or evenings, because our regular day phone is not working. I mean, nobody's here. So you can use that pager number anytime for any question, not just these, but definitely for these too. So
2 more questions if you've got time.
yeah. And did I give you that number, that 24/7 number? Do you have it there?
I'm sure we have it. I'm just not in the lab.
Oh, okay. No, that's fine. So just to give it to you, it should be the 402-888-5588. Did I say that right?
5588?
Yes. Hold on. I can't believe I don't remember it. If Tony were on now, he would be correcting me. Well, anyway, I think it will be Marissa, it will be in my handout I give to you right after this.
Okay.
It will be written in there. And so if it's not already in your laboratory, please post it in your laboratory. Yeah.
Sure.
Let's see. And yes, please go ahead.
I'm sorry, on the shipper's declaration, do we need to put suspected category A infectious substance or actually spell out the organism name?
So that's no, to be honest with you, you can, a lot of times what you'll do on the challenge set or the LPX, I think you guys might be going to LPX, but I think you'll still get my challenge set too. What I would do is you're given usually some answers and you just have to pick the best answer. So I would say suspicious, but then they'll ask you, okay, what is it suspicious for? So they really want you to kind of nibble it down or gear it down to one of those families we talked about. Is it gram-positive rod, like the Bacillus anthracis? Is it a gram-negative rod, like your Yersinia, Burkholderia, pseudomallii? Or is it that last weird group that's so small, it's hard to read, and that'd be the Francisella, Brucella, and the B. mallii. So you can say suspecting BA or suspecting, Yersinia. So doing that LRN will help you bring it down to one of those possible cases. Yeah. Yeah.
Okay, and then my boss had a question and I'm trying to understand what her question was.
Okay. Try it. Maybe I'll figure.
Instruct courier to take package to UNMC Regional Medical Services Center? Pathology Service Center.
Yeah. Okay. So here's the story with that. I think I know what she's saying. All category A's have to be ground couriered by what we call exclusive. Now, exclusive doesn't mean like they're just driving from Omaha to Lincoln to get your specimen. What exclusive means is they carry the liability, they are properly trained, they've done bloodborne training, they don't have food in their car, they don't have grandchildren in their car, they don't have other people, they don't have bank bags, they don't have US mail. See, all these other couriers that go across Nebraska, unfortunately, they're not exclusive. They'll tell you they are, but they're not because they define exclusive differently. So what I would say is that there's only one courier between Lincoln, Omaha, and Grand Island that is exclusive. And I usually, when we find out, work with you and you're not able to rule out that organism, we actually do the calling for you.
Oh, okay.
Yeah. But if for some reason you guys forget to call us or don't call us or don't, I don't know what the extenuating circumstances might be, but if you have to send something to us, make sure that it's that courier. So,
Okay.
yeah,
Thank
just
you very
be
much.
aware that it has to go through an exclusive category A courier. So I think that's what she meant.
Okay. Thank you so much.
All right, good. Take care.
Stay safe.